welcome to Aesthetic TV. I'm Stuart Brazell. We're here today to discuss the modern female patient that gets plastic surgery and related aesthetic procedures. Who is she? What are her needs and what services are available to her? I'm here with four of the most experienced, respected, and accomplished female providers of aesthetic procedures. Collectively, these women have treated thousands of patients in their practices over many years. Dr. Petti is a board-certified plastic surgeon in private practice in the Los Angeles area, where she specializes in aesthetic plastic surgery, aesthetic laser surgery, and non-invasive surgical cosmetic rejuvenation procedures. Welcome.
Thank you for the invitation. It's a pleasure to be here.
Dr. Sharon McQuillan is a board-certified practitioner who specializes in both anti-aging, aesthetic, and regenerative medicine. She is the founder and medical director at the Ageless Aesthetic Institute and Ageless Regenerative Institute in Fort Lauderdale, Florida, and she is the medical editor for New You magazine. Welcome to you.
Thank you, Stuart. It's a pleasure to be included in this group and an exciting project.
Dr. Candace Spann is a board-certified dermatologist in Las Vegas, where she practices cosmetic and general dermatology. Along with her husband, plastic surgeon Dr. Marvin Spann, she founded Couture Dermatology and Plastic Surgery. Welcome to you.
Thank you so much, Stuart.
Lori Robertson is an aesthetic nurse practitioner and the clinical director and owner of Ageless Medical Aesthetics in Brea, California. She is also a clinical educator and trainer for injectables and lasers, and an expert in the use of aesthetic lasers and other energy-based aesthetic devices. And welcome to you.
Thank you so much, Stuart. It's a pleasure.
So, Dr. McQuillan, please tell us about your specialized work in anti-aging aesthetics.
Well, anti-aging medicine is actually a subspecialty that's been around for 25 years, and it is to create optimal health in our patients. And aesthetics is part of that, but for the health portion, we focus on natural hormone replacement. We also focus on detoxification, individualized attention to metabolism, and more recently, stem cells. And so it's very complex work with our patients, and we believe, and we've seen with our patients, that if you make someone healthy, they're going to look more beautiful. And so we do aesthetic procedures, and we do all the things that we do with the injectables and the lasers, but I have a bias in that I believe that it's difficult to be beautiful if you're not first healthy. So that's my focus.
Well, very well said. That's so important. Now, Dr. Petti, what's your special interest?
One of my areas of special interest is actually cosmetic surgery of the breast. Being a woman, women are naturally very comfortable coming to me about breast augmentation surgery. And not only primary breast augmentation surgery, meaning first time around, of course making the woman feel very comfortable about that decision, but also there's so many women that have had poor breast augmentation surgeries done, and they have problems with contractures and asymmetries, and a lot of times they'll let that go on for a long time, and finally something will bring them in, sometimes a rupture or sometimes a new relationship.
Absolutely.
So that is very challenging surgery because you have to actually take something that totally looks abnormal and make it look normal and beautiful.
And speaking of women-related issues, I know, Dr. Spann, that you work with women who are suffering from baldness. Can you tell me a little bit more about that?
Sure. Women's hair loss is something that's kind of been neglected up until now. And so we realized that 40% of the hair loss market is female, even though it's treated as a male problem. There are fully 30 million women in this country alone that are suffering with thinning hair. Now, of course, all of us are aesthetic practitioners, and you can revolumize the face and contour the body, but if the woman's hair is shedding or affected, really until you address that problem, we're not going to have a true response in terms of her aesthetic improvement. So I have developed a product line for women with thinning hair. We're launching in September in 65 Sephoras across the country. The name of the product line is Retress. It's an all-natural product line that works very effectively across all different ages, races, ethnicities, and in our clinical trials we have about a 95% success rate. It's really been a life changer for a lot of people.
Congrats, that's wonderful.
Thank you so
Excellent.
much. Thank you.
Now, Lori, you specialize in non-invasive procedures. Can you tell us more about that?
Absolutely. I do, as opposed to other surgeons. I'm a nurse practitioner. So when people come into me, I really want to focus on what bothers them. And generally, I can really help them revolumize, help to relax wrinkles in a non-invasive way. So I can use a lot of dermal fillers. I can, basically my motto is I want to replace, not overfill. I look at patients and I look at where they've lost bone mass, where they've lost deep and superficial fat, how the aging process has done with them as far as skin integrity and loss of volume. And I can replace it so that they can look like they used to look, which gives them a refreshed look, not an overdone look. So that's really, really my priority. And I come from an aspect of, I want people to know why I'm there. I'm there to help you feel better about yourself. I'm here for you, because if you're happy, I'm happy. And sometimes it just takes a little bit to help take off that spot, or just tighten a little bit, or do a little bit of volumization, and people look at themselves in a different way and their whole attitude changes. And that makes my day.
Well, I can tell we're in for a great discussion. So let's get to it, ladies. Now, according to Medical Insight Research, the leading aesthetic procedures for women are facial injectables, such as Botox and dermal fillers, body shaping, skin tightening, and hair removal. So what procedures do you think that patients ask for the most? What's most popular?
I think hands down the neuromodulators, Botox, Dysport, Xeomin are the things that get people in the door. But once they get there and realize how much more there is available, they're much more inclined to try other procedures.
I agree. I think that's a good way to get the patient introduced to non-invasive techniques.
Exactly.
When people come in, many times they know they're in your office because they're not happy with how they look. They're not really clear on what they need. Maybe they've read many of the popular magazines and they have an idea that they need a specific filler or a specific laser or a specific procedure. But it's up to us as experts to guide them to make good decisions for themselves, to make good investment in their time and their money and what the procedure is going to entail. So I think the consultation is the most important thing, where we can help guide our patients to make good selections on the neuromodulators, the fillers, the lasers, the surgeries that are available.
Is it still common to see women coming in for the first time, say in their 50s or even older?
I feel like this age is moving much younger. The idea of prevention has really taken off recently. So I do have some women as young as their 20s that are coming in, but I also have women that are in their 80s that are coming in. They feel good, they want to look good.
Why not?
I agree. I do see quite a few that are in their 50s coming in because they've got their kids off, they're married, they're gone, and now is the time to take care of themselves. So they tell me, I want to focus on myself. I've let myself go, I've been in the sun, look, and they've got some things they want to take care of. So I see that oftentimes in the 50s, but I also see some of the younger women coming in their 20s and 30s who want some preventative things and who notice things a little bit earlier than maybe years ago they used to. So they're more attuned to some of the things that are out there to do what I call fine-tuning and not major remodeling.
Exactly.
So, yeah.
And as far as the younger population,
I was going to say the tweens.
they're very educated. So they see everything on Facebook, all the advertising that's put in front of them. And so they're very educated about all the popular procedures. So recently this spring I had a very interesting situation where a mother came in and she had had breast implants. Her saline implant ruptured. I replaced it with silicone gel, and she said, while you're there, can you do my neck, because I'm 50, and look, this has changed. I'm different than I was, 15 years ago. So I redid the breasts, and then I did a procedure known as Precision TX, which is a laser contouring procedure, minimally invasive of the neck. And then her daughters were caring for her afterward because she had the breast surgery, and they're like, wow, this is a fabulous result. They were actually born, their father actually had thick neck. So they saw what was done with their mom's neck, and I looked at them, and they had, a very full neck. You could hardly see their chin. They weren't overweight. It's just that's the way they had what I call a genetically predetermined neck contour. So I actually ended up operating within 6 weeks on the two daughters, 122 and 124. And the whole family's happy.
That's a great story. Let's talk about managing that relationship with your patients and especially their expectations.
Sure.
Advice on how to do
So,
that.
you know, the patients come in sometimes expecting miracles. If you're 85 years old, I can't make you look like you're 25 years old. And I do think it's important to say that. My husband always says the only way to get a surgical result is with surgery. And so there's a limitation sometimes to what can be accomplished with non-invasive procedures, and even with surgical procedures, we don't stop the aging process from happening, unfortunately.
And I have actually a neat computer technique in my office where the patient comes in and they have their photographs taken. We load the photographs, and right at the time of the consultation, they get to see themselves. And I use that picture then to outline their anatomy, to give them the informed consent of what their options are according to their anatomy. And like you all said, I mean, some of them will be candidates for non-invasive, but unfortunately sometimes there's the bad news where they've gone beyond the point of non-surgical, and we need to speak about, you know, perhaps more invasive procedures. So that's so important, to listen to the patient and to educate them about their specific anatomy, not their friends.
Right.
And don't you think, in all of our experience, that it's primarily when people have loose skin in their neck and they have jowling?
Yes.
Don't you honestly think that that is best handled with a surgical procedure?
I guess the degree of it
Yes.
is really the determinant,
Right.
because if there's just a little bit,
If
sometimes
it's just
you can
a little bit, we can do
accomplish a
radio
lot with
frequency.
radio frequency or an ultrasound-based device.
Yes.
Or even the new Ulthera,
The
but
new
that's
Ulthera.
just minimal.
But
But if somebody really has
if there's a
loose
good
skin,
loose skin, then
Right,
I
you have
see-
to get
You
into
have to.
talking to them about surgical procedures and, of course, incisions and downtime and so forth. But, you know, if it's needed, it's needed. And you must give them, you know, the opinion that fits their anatomy. That's important.
I think that's really important. I think managing expectations is paramount. And if anything, my motto is under promise and over deliver.
absolutely.
I totally agree.
That's a great
Your
motto.
patient
I
is
love
going
that.
to be happy with you. And when we're talking about non-invasive neck, non-invasive belly tightening, whatever it might be, honestly, research has shown that I don't care what the mechanism is. It could be ultrasound, it could be radio frequency, it could be lasers. You get the heat in the skin long enough, you're going to stimulate collagen.
It's inflammation.
Yeah.
But
Yeah,
you're
you
only
create
gonna get-
inflammation, that creates collagen production.
Exactly.
Exactly, but you're only going to get about 14.7% tightening.
Right.
That's pretty much all your body's going to do.
So there's still hope for the surgeon.
Absolutely. And if we, as providers like myself who do non-invasive things, if I tell you, expect maybe 14.7%, 15% tightening with all these treatments, that's what I can promise you. And if they go, that's nothing, or I've had people say, that's awesome.
Right.
Right.
You know, it's really up to that patient. Whatever they
Absolutely.
expect is what I want to deliver.
And then realistic photographs really help, because there are a lot of photographs out there from the commercial vendors which are not really representative of our results,
Right.
I would say. And so I think having photographs where you can show realistic results are important.
Oh, I couldn't agree
mean,
more. It's
And
really
you
not fair to
touched
show the
upon
home run.
something I'd like to discuss further with talking about these photos that are unrealistic. What do you do when you have a patient come in and they just have completely unrealistic expectations of what they want done, what the results should be, or you know, they have a photo of a movie star and they're requesting that. What do you do?
I think
Yeah.
you have to really be honest with them. You have to tell them what you can do for them, break down their anatomy, tell them the differences that they have from this particular, you know, celebrity. I also have the girls come in that have droopy breasts, and they bring in a picture of a patient that perhaps, I mean, has their arm over their head, and I say to them, look, it looks perky because their arm's up.
Right.
You know, I mean, they're positioning them to make them look their best.
Like that's someone's selfie that they took
Exactly.
versions of.
Right.
It's not
That's
real.
the best one.
Yes. So again, and I think with the selfie, let's get on to that. I mean, that's interesting because now the patients are looking at themselves. They are seeing everything.
I have to ask, I have been, you know, hearing a lot, and with Instagram being so popular, there are women that are having hand lifts for their engagement selfie photos of just for their Instagram of their rings.
Oh my
it's
gosh.
getting out of control a
It's
little
They
bit.
need to
totally
find
out of
something to
control.
do.
Everybody needs a job or something. It's like, get a job, get a life, do something.
If that's your biggest worry is your hand on your Instagram with your ring, come on.
But oftentimes, you know, I feel too that it's our job as a provider to stop them.
You're so right. You're so right.
I'm known to say, you know what, no, you don't need that. You really do. Come back in 6 months and I'll tell you if you need it or not.
Sure.
You have to know when to say no.
We have to recenter our patients.
And your staff knows has to be well educated too.
absolutely.
I was going to say, because they get the phone calls and they have to come and tell you about what people have been relating to them over the phone.
Right.
If they're changing their procedure every other week, you know, that's a bad sign, because no matter what procedure you do, you're going to lose because you're not going to do the right one.
Exactly.
I've had that.
Patient
Have you experienced
selection.
anything
Patient
like that?
selection is crucial to having
Absolutely.
a good outcome, and we have in Las Vegas maybe a few people who have more of an unrealistic expectation because they're performing all the time. They're
they're on
hypercritical
camera.
of their bodies. They're on
course.
camera,
In California,
and so of course
Sometimes
in California
suffering
and
from
New
body
York,
Florida.
dysmorphia.
body
Exactly.
dysmorphic
well, actually,
disorder.
let's face it, now that we have the media and we have all of this internet access.
And the selfie generation, as we
and
call
it
it.
is
HDTV.
everywhere. It's not
I
just
call
on
it the
both
I
coasts.
generation.
Oh, absolutely.
And so, and the other thing that we have is Photoshop has created an unrealistic expectation
absolutely.
for
Oh my gosh,
everyone.
yes, yes.
You know, all the work that we can do has really raised the bar.
Hence the reason
So
for in
there is a
in
lot
my
of stress.
reception area,
Yeah.
I have only Bon Appetit, Home and Garden. I don't have any of the glamour magazines because they're all airbrushed.
I mean,
So
even
that
celebrities
gives-
are calling out, you know, with Lena Dunham, she said, why did you Photoshop me? I am voluptuous. I do not look like that.
It
Exactly.
just gives them unrealistic expectations. And then I always tell my patients, you know, I can only fix what God gave you.
Right.
If you come in with no lips, I can't give you Angelina Jolie's lips. You know, it's not possible, but here's what I can do.
Right.
But you have to let
Focus
them
on the
know-
positive, I think, is very important, because so many patients come into our offices having poor self-esteem. That's huge. It could be from a relationship. You know, it could be maybe the way they were raised, or maybe something they were born with that they really can't correct and control, and they're looking to us for solutions. So we really have to be, I think, you know, one thing I've learned is to be a great listener.
Absolutely. It's
That is so important. I
And also-
actually think the relationship that we establish with our patients is the most critical piece, because we can help them feel better about themselves, like Lori said earlier, and that's really our role. It doesn't matter if we move their eyebrow a millimeter or if we move their neck. It matters if they feel confident so that they can function in their lives.
And once we've established that rapport with them and we've listened to them, then we can educate them about what is natural and appropriate for them.
And
To
what is-
me, the hallmark of good aesthetic work is where you can't really tell what has
Absolutely.
been done.
It
I
has
know
to be natural.
you all don't have to admit it, but I know I'm not the only one who injects myself here. Right? And so I always tell the patients, I don't ever want you to look at me and say, oh, she's had work done.
Right.
I will tell you what I have done
I
for
tell them
marketing
I'm a
purposes.
consumer.
I'm a
I
consumer.
believe in what I do.
Exactly.
Anything that I have in my office for treatment, or
We've
any
tried.
procedure that I do in the operating room, is something that I would gladly undergo myself.
Exactly. But
you know?
my point is never to make anyone look like anyone other than themselves.
That's
I
right.
want you to look like the best version of yourself.
Absolutely.
And that is probably what 90%, most of our patients want to look like a younger, more vital version of themselves.
And that's where replacing what they've lost and not
Is helpful,
overfilling
yeah.
or overdoing absolutely comes into it. Sometimes they'll bring in pictures of 10 years ago, and I can look at what they were 10 years
It's
ago.
better
so-
to bring in a picture of themselves than a celebrity.
Exactly.
I think another important point is, you know, sometimes people are afraid of these procedures. We're talking non-invasive or invasive surgical. They say, well, I don't want to change. And in my head is what I say. I'm saying in my head, I don't say it out loud, but here I am saying it. Okay. No, is that you're going to change. And people need to understand that without surgery, they're going to change. If you took a picture of them, you know, at age 40 and you compared it to age 20, they're different. I mean, how many times do you walk into a setting where you see someone that you haven't seen for 20 years and you're like, that's him or that's her, and they haven't had anything done. You know that because maybe you know them well. And oh my gosh, I mean, they've changed tremendously. So why not change for the better?
Sure, absolutely.
Well, it has been so wonderful chatting with the four of you. Any final thoughts?
Well, one thing, I would just like to thank you, Stuart, because I appreciate this forum where you have medical experts that can help to guide your audience, because there's so much information on the internet right now, and then popular magazines, which may not be the best for patients and is not really a credible resource.
And not subject to review.
Exactly.
Anybody
so
can write
important.
anything, and
Right.
they're the expert because they wrote it.
And so I would just say, as patients, find yourself an aesthetic provider that you do trust, establish a relationship that you want to maintain so that they can guide you, and to value that.
Thank you all so much for being here on Aesthetic TV. This has been such a wonderful discussion.
Thank you
Our
so much
pleasure.
for
Thank you
having
for the
us.
invitation.
Yes, and thank you for joining us. As always, we are glad to have you with us here on Aesthetic TV. I'm Stuart Brazell. Stay tuned and stay beautiful.